the nail. And then at the bottom, you have the Hyponychium. You then have the Luluna, which is like a half moon. You can see it on some people's nails, but you can't see it on everybody's nails, but everybody has a Luluna. Cuticle, which is what we cut when we do a manicure or a pedicure, and what we move back. We then have the matrix, which is under here. You don't actually see it. The nail groove is the little area in which the nail sits, not the bed at the side, but the groove that it sits in. The Hyponychium, which is down the bottom here, and the nail mantle. So these are all the structures within the nail itself. So let's look at their functions. What do they do? Why are they there? So the nail plate protects the living nail bed of the fingers and toes. So the nail plate is an active structure. It's not alive. It has no nerve endings. It has no blood supply. So it's almost like a window with you looking through. Yes? So it is protecting the living part of the nail, or a living part of the nail, which is called the nail bed. The free edge protects the tip of the fingers and toes and the hypercanicium. So let's just drop back again. So the free edge, remember it started from your finger. Anything that goes over the tip of your finger is classed as the free edge. Anything that is actually on the finger is the nail bed. Okay? Then we have the, oh yes, I didn't tell you about the hypercanic, sorry ladies. And the hypercanicium is that little area just at the top. You know, if you've had false nails on and you've caught the nail and it's very sore, very, very sore, it hurts. Well, it's a sealing at the top of the nail to protect any dirt or bacteria from going in. Hypercanicium. Yes? Can be torn and it's quite painful. Then you have the matrix. The matrix is the area that produces new cells. Can you have a look? Your matrix, yes? Right at the bottom of the nail. So that's where our new cells are actually produced to form our new nail. The nail bed, this supplies nutriment and protection, yes, to the nail. It has a blood supply, so it will get nutrients. Also have nerve endings, so that's where you can feel pain. If you damage that area, it will bleed and it can scar. Nail mantle. This protects the matrix from physical damage. So can we see the nail mantles just underneath the cuticle? And this will protect the matrix from physical damage. If you damage the matrix, you know, like we close our fingers indoors and extra, or we lose that nail, as I said, it can have scar tissue, and the matrix will produce cells around the scar tissue, so that damage will always show through on your nails. Then we have the Luluna. The Luluna has no function, okay? The Luluna is there because it's a changing of cells. It's the cells from the matrix, which are new cells, which is going through a process called keratinization, which means it's dying. And because it's dying, you get that opaque color. Okay, so it has no function at all. Everybody has a Luluna. Even if you look at your nails and you can't see it, it is present. It's the living cells transferring into dying cells. When they go onto the nail plate, they're actually bed. Okay. Then we have the nail grooves, and these guides the body of the nail plate as it grows forward. So it sits in these little grooves and keeps it straight. Once it comes off the tip of your nails, I don't know if anybody's seen people with very long nails, the nails start to misshape. They bend over, they can twist, they can curl, because there's no grooves holding it in place. So while it's actually on the nail bed, it will stay flat and it will stay in shape. Once it grows past the nail bed, then it can distort because there's nothing guiding it. And then we have the nail walls, which is the sides, and these cushions and protects the nail plate and the grooves from any damages. Okay, so those were the functions of the structure of the nail. We've also got the Hypercanic, which I spoke about, protects the nail bed from infection at the top of the nail. Hyper, high, hyper. The Pericanicium protects the nail bed from infection. So look where the nail bed at the side, it stops infection. So they're like seals, stopping bacteria from going into the area. And the Epicynicium is at the bottom, and this protects the matrix from infection. The cuticle also protects the matrix from infection. So in some cultures, in some countries, when you do a manicure or a pedicure, they cut away the cuticle, as we do sometimes. Some cultures, they don't cut it away. Some countries, they leave the cuticle there because it's a form of protection. Okay. Right, so let's look at the growth of the nail itself. The cells divide by mitosis in the matrix, and the nail grows forward of the nail bed. The nail growth is guided by nail groove. When the nail reaches the end of the finger or toes, it then becomes a free edge. So until that nail has got to the top of the tip of the finger, it is a nail bed. Sorry, it's not a nail bed, it's a nail plate. It's resting on the nail bed. Once it comes to the end of the tip of your finger or toes, it becomes a free edge. Cells, when they first emerge from the matrix, are translucent, plump, and soft. The cells get harder and flatter as they move towards the free edge. So remember I spoke to you about the laluna, yes? It was that area that didn't really do anything, but it has an opaque color. That's when the cells have emerged from the matrix and they start to move up the nail plate. They're starting to die. The cells get harder and flatter as they move towards the free edge. The layers of the epidermis form the nail plate, and the remaining 3 form the nail bed. So the top 2 layers of the skin, the epidermis, the outer layer of the skin, form the nail plate. And those 2 top layers, stratum corneum, yes, stratum lucidium. Unique things about those 2 areas, the clear or the horny layer, is one is transparent and waterproof. Do you remember that? If we've done the skin. And the second is that it's dead. It has gone through a process called keratinization. Yes, completely dead. Reproduce, it's hard, soft, flat tissue. So the nail cells die in a process called keratinization, where the cells become filled with a protein called keratin. Anybody heard of keratin anywhere else? That we have keratin. Yep, who said yes?
Me.
Is that Sam? Sam, where else can you, where have you heard keratin?
I think from the last session we did last week regarding the hair.
Good girl. Yes,
Yeah.
good girl. Yes. Keratin was in the hair. So the hair went through, and remember I said it happens in the skin, it happens in the hair, and it happens in the nails. Okay, so keratin is a byproduct of the cells dying off and going through a process called keratinization. Okay, well done. The nail bed has a pattern of grooves and furrows. So if I could take my nail off and turn it round and have a look, it's got lines on the inside of my nail, and on my nail bed, it also has lines, and my nail plate fits in the lines like that. Yes? So as it fits in, it grows. So if my wrist is the free edge, can you see that growing? Yeah, so we'd start down here, I'd follow in the fingers, come, go in my left hand to the nail bed, and then I come off the free edge. You see how it grows forward like that? So there's little grooves and furrows, and it sits. So that's how my nail is quite firm. It's not really the nail root, it's actually following like railway tracks on each other, and actually then growing up. And this is why the free edge can easily break, because there's no more nail bed or anything supporting it. Can you see it at the end? Yeah. So it can snap, it can break, it can twist. There's nothing's guiding it. It can curve over. Okay. Fingernails will grow twice as fast as toenails. It takes approximately 6 months for a fingernail to grow from the cuticle, the free edge. So that little movement that I've made from the wrist down there, and it's coming up, yeah, will take approximately 6 months for me to get that free edge. Okay, it's a fingernail. But it's about 12 months toenail to do so. So the toenails take twice the time. Okay, 6 months for a fingernail, 12 months for a toenail, and other things will take into consideration. Just like the hair, it's your health, yes, medication that you're taking, your diet. So these things will affect how fast your nails will grow, how strong they will grow. All right. Does anybody want to ask any questions about nails? Is there anything that you want me to go over again? I could just briefly go over the whole PowerPoint, or all be all happy with that. Thumbs up if we're not, thumbs down if you want me to do again. Is there thumbs up or down? Sam, are you good? Lovely. Deanna, you good? Chantal, you good, darling? Good girl. Right,
Debbie,
lovely. Yes, sweetie.
Sorry, it's Sabrina here. If we
Oh,
could,
Sabrina.
I think if we could do the first couple of slides again, just because we had
Yeah,
some people
sure.
enter from the waiting room.
There's some joiners, yes.
Yeah, so that would be great, just so they don't miss anything.
No, that's fine. Sorry,
Right.
you know what? Let me drop down and just say hello. Yes, I can see now.
Yeah, no
I
problem.
keep forgetting to drop down. I'm just going to go back up so we can just recover. We'll just go over
Lovely,
very
thank
quickly.
you.
Excellent. Thank you, Sabrina. Okay, so just recap for us all. The nail itself, we looked at the structure. So these were all the structures that made up the nail. The nail plate, the free edge, the matrix, the nail bed, the nail mantle, the laluna, nail grooves, nail walls, hypocanychium, pericanicium, and epicanychium. So if we look at our little picture, free edge, anything past the tip of the nail, of the finger. The epicanychium is underneath, yeah, and if you pull your finger forward, you can feel it pulling. Yes, quite painful when it actually does tear, and that's the seal that will protect the nail bed from getting bacteria. Then we have the nail plate, which we like to decorate and paint and do gel on. Yes, that's a hard dead cells. We have the nail wall at the side here. The nail bed is what you can see, that lovely pink colour. Yes, because that has a blood supply. The nail plate doesn't have a blood supply. It is dead, clear tissue. So when we break our nail off, you can see it's just dead tissue. There's no pinkness unless it's got pink nail polish on it. And we have the pericanicium. So think of the perimeter around the outside, perimeter. That protects bacteria from going in at the side of the nail bed. La luna, yes, half moon. Again, even if you cannot see your la luna, everybody has one present. It is the cells migrating up the nail plate, but they're living cells in the matrix and they are starting to die. They're going through a process of keratinization. Then we have the cuticle, which we like to cut away. As I said, some countries don't cut away the cuticle because it's there as a form of protection. Okay, but some people do like it done. The matrix is where mitosis happens and our cells all reproduce. We've got the nail mantle, which is a seal at the bottom of the nail, also help from bacteria from getting in and protecting the matrix. Hyponychium, that's the seal, and the nail groove. Okay, so we've got the nail wall, which is the fleshy bit, and you can see that your nail fits in a little groove at the side. And the next slide is the function. I've covered most of the functions, as I was telling you. So we said the nail plate protects the living nail bed of the fingers and toes. Free edge protects the tips of the fingers and toes, and the hypercanic. The matrix produces new nail cells. The nail bed supplies nutriment and protection. The nail mantle protects the matrix from physical damage, and the luna has no real function. So it's just there because it's just the dead cell, the cells dying basically and moving forward. The nail groove guides the body of the nail plate as it grows forward, and the nail walls cushions and protects the nail plates and grooves damage. Hypercanicium protects the nail bed from infection, right at the top of the nail. Pericanicium, perimeter. The outside protects the nail bed from infection. The epicanicium at the bottom of the nail protects the matrix from infection. So remember, hyper and pericaniciums protects the nail bed, but the epicanicium protects the matrix. The cuticle also protects the matrix and the nail bed from infection. Okay, so both of them there. Okay, then we spoke about the growth. The cells divide from the matrix and grow forward over the nail bed. The nail growth is guided by nail grooves, little railway tracks moving forward. When the nail reaches the end of the finger, it then becomes the free edge. When the cells first emerge from the matrix, they are translucent, plump, and soft. The epidermis and the nail, the remaining three are the nail bed. So the top two layers, the clear layer and the horny layer, make the nail plate. So that's why the nail plate is translucent. And the other three layers will make the nail bed. the nail cells die in a process called keratinization. We had a look, let us know that we spoke about keratin and keratinization when we looked at the hair. And this is where a protein called keratin fills the cells as they die away. Okay, so I'm just going to drop this. Okay, lovely. Then we looked at the, what did we not? Yes. Okay. Right, so the nail bed has a pattern of grooves and furrows. Remember the little railway track that I showed you? These are found on the underside of the nail plate, and the two surfaces interlock, so it holds the nail nice and flat. Fingernails grow twice as fast as toenails. It takes approximately 6 months for a fingernail to grow from cuticle to free edge, but twice as long, 12 months, for a toenail to do so. So anybody, we paint or we gel our toenails, you notice our fingernails will chip off much quicker or grow out. Our toenails let stay a longer time because it grows at a slower pace. Okay, and we don't use them as tools. They're in our shoes rather than being washed, especially in these times, COVID. We're washing our hands every few minutes, aren't we? So our toenails don't need to go through that trauma as much as the fingernails. Okay, so again, I'd like to see a lovely thumbs up if we're all happy with that. Seconds. Lovely thumbs up. Yep, everybody's happy. I'm just going to drop down and see that everybody on the second. Everybody here, thumbs up. We're good. Shatalia, good. Excellent. Well done, my darling. Brilliant. The next thing that I want us to have a look at is the bones, but just the bones of the hand. So let me just find that. Okay, so we're just going to skip all these. I'm going to do like miss this and come back to it. Okay. Right, so we're going to, sorry, the bones of the head first. We're going to look at the bones of the head. Again, quite important to us as beauty therapists. The bones which form the head are known as the skull. The skull is divided into two parts, the face and the cranium. So, ladies, we have the skull, which is known as all the bones of the head. Okay, so my whole head is my skull, but then my skull is divided into two, my face and my cranium. Just up there. Altogether, this is made up of 22 bones. 14 bones will form my face, and 8 bones will form my cranium. So 22 bones in total. And here they all are. You 14 bones of the face. And don't forget, our face is in half, so some of them have 2, some have 1. Okay, so we have the nasal, the vomer, palatine, the turbitine, the occipital, the zygomatic or molar, the maxilla, the mandible. Yes, nasal has 2, I should say which one. Vomer had 1, palatine 2, turbitine 2, occipital 2, zygomatic, which is your cheekbone, has 2, maxilla has 2, and mandible has 1. Then you've got the bones, 8 bones of the cranium, or cranial bones. On top, occipital, frontal, parietal, temporal, oid, and sphenoid. occipital 1, parotoid 2, frontoid 1, tempoid 2, ethmoid 1, sphenoid 1. Okay, let's have a look at them in their position. And this is usually a picture of what you would see. Okay. Now, on this picture on your left-hand side, you can see on the skull there are little wavy lines. Those are called sutures. Okay, like the stitches. And when the lady is having her baby, and obviously she has to give birth to this baby, the area that I know it does stretch, but the area that the baby's coming out is tiny. Okay, there's no ifs and buts about it. The baby's head is much bigger than that. But what happens when you have a baby, you can see that the baby's head is quite soft and pliable. And sometimes when you have a baby for a few weeks or so, the baby's head is misshapen, depending how they had to try and get this baby out. But what happens, we don't have a solid skull. Yes, baby skulls are not solid. So what happens is the bones can slightly slide, interlock over each other. Yes, so that it can squash out of the entrance. And then it stays like that for a few months. And even you can, with new babies, you know, there's a bit where it's open. You can actually feel it, yes? And after a while, the sutures uncross and then they form hard. These were the areas where the bones were soft when you were a baby and they could actually interslide with one another. So they're called sutures. Okay. In beauty therapy, we also need to know about the bones of the neck, chest, and shoulders. So there are 15 bones in total that we all need to know about. 15 bones. The sternum, the humerus, the scapula, the clavicle, the hyoid, and the cervical vertebrae. Sternum. Let's make this a little bit bigger so we can have a look. Okay, right. The breastbone, right in the middle. Okay, we're doing open heart surgery. They have to go and actually pull it apart to actually do surgery on the heart. So when we're massaging or we're working on that area, we're working on the sternum. There's one bone. The humerus bone, okay, you can see, is along from the shoulder to the elbow. Okay, so obviously we've got two hands, so we have two bones, one on each side of the body. Then you have this scapular bone, and that one's, when you turn to your back, it's the shoulder blades. Okay, at the back of you, one of each on each side. The clavicle or the collarbone, which is here, that is one of the easiest bones to break because it's so thin. Yeah, so the clavicle bone. There's two, hyoid bone, which is up in the neck, and it's a tiny weeny bone here. And when the forensic people are looking at people that have, which they suspect have been strangled, 9 out of 10 times that tiny hyoid bone, really tiny, is with the squeezing is broken, and that's one of the ways they can determine that that person has been strangled, because 9 out of 10 times that bone is actually broken. So a very, very tiny bone. That's only one of them. And the vertebrae are bones of the neck, chest, and shoulder. So it's the vertebrae at the back. Starting from the occipital bone, which is at the back, going down the neck, going down into the shoulders. Okay, you can see it there in the middle. That's your neck area. Okay, so we're going to go on. So that was our bones of our head and our chest, and it even had the arms. We need to know about the arms because in level 2 and level 3, we massage onto the arms. So we need to know the bones of the arms. When we do a manicure, we also need to know about the bones of the hand and forearm. So this was our arms here. From the wrist to the elbow is called your forearm. Okay, so there's 8 wrist bones, which collectively are called carpals. So 8 wrist bones collectively called carpals. There, I'm going to make that a tiny bit smaller so you can see. There are 5 hand bones, and these are called metacarpals. So carpals, and then these ones here are your metacarpals. Feel them, yes? Like in the palms of the hand, metacarpals. Then there's 14 finger bones, and these are called phalanges. So we have 8 carpals, 5 metacarpals, and 14 bones. Can you see why there's 14? Look at the fingers. They're literally got 3 bones each. Yeah? They're called phalanges, fingers. And then there's 3 bones of the arm that we have to learn about: the humerus, the radius, and the ulna. Let's have a look at those. Oops, come onto the feet. Let's see if I can pick it up from here. No. Okay, no problem. Okay. This has gone onto the feet, but we don't need to learn. Okay, I'm not going to take us any further. We've done very well. We have looked at the nail, which is quite important for us to learn. And we're going to do a nice little fun bit now. So if you could take your papers, ladies, for our little pop quiz. And if you put a T on one piece of paper or one side and put an F on the other side so that you can hands up, all of it's going to be true or false. So you can just show me the T's and the F's. You'll have to bear with me because I have to go through everybody. Darshna, we've got Darshna joined, but she hasn't got her picture up. Okay, no problem. Right, so the ladies that are there, let's go. Okay, so are you ready for your questions, ladies? The first question is about the nails. And it says, the nail plate is living tissue. The nail plate is living tissue. Can I see a T or an F held up, please? Okay, thank you.